much. It's for me a pleasure to be here.
Thank you so much. Next we have, I'm not sure, I can't see the screen, but we have Miss Odette Charles.
She is here.
Hi, Odette. Please introduce yourself and tell us a little bit about the work you do.
Okay, hi, good morning from Trinidad and Tobago. It's about 2:35 a.m. I am Odette Charles. I am program manager for a program under MIC Institute of Technology that targets underprivileged persons at risk youth. So I do a lot of work with tech work education, where we reskill these persons and give them the opportunity to either become entrepreneurs or to become employed by one of our industry partners. I'm also a corporate etiquette and international protocol consultant, coach, and mentor, mother of 3 adult children as well.
And thank you both so much. Thank you both so much for being here. The timing is a little inconvenient for both of you. Vanessa, I do hope that you sleep tonight. But next, I have another feeling that one more person has joined in the at an inconvenient time, Miss Purity Naga. Please introduce yourself and tell us a little bit about what you do.
Hello and good morning, everyone. My name's Purity Wanderinyaga. I'm a consultant, a trainer, and a counselor on entrepreneurship matters, working with the Ministry of Trade Kenya since 2008. And I'm sure passionate on matters touching on girls and women. And I'm very glad to be invited in this particular conference. Thank you.
And next, I see Dr. Garima Thakur. Dr. Garima, namaste. Welcome to the show. Please tell us a little bit about the fantastic work that you do.
Sure. First of all, namaskar to everyone and welcome to this beautiful webinar. And I'm so happy, Priyanka ji, to you and to you also to make us be together. This beautiful. Myself, Dr. Garima Thakur. I am a senior consultant at Rudramya, Himachal Pradesh, basically from Himachal Pradesh. And I'm for past 20 years, I'm practicing Ayurveda, naturopathy, yoga, Reiki, acupressure, acupuncture, panchkarma. And with this, I have expertise on my pulse diagnosis, which is a Nadi Gyan Chikitsa, with which I get to know the constitution of the person and treat the person according to the constitutional part. Doing this work for past 20 years and working out with these, I have done many chronic diseases to be cured with the Ayurveda, and the healing have been done with all the holistic approaches. So I'm very delighted to join you all here and today to learn many good things from you all. Thank you.
Thank you so much, Dr. Thakur. Next, we have Miss Manisha Patel. I think your mic is still muted.
Yeah, hi everyone. I'm Manisha Patil. I lead inclusion and diversity and community engagement for Amazon India. And as a part of our community engagement program, we work very closely with the underprivileged women across 10 states of India. And our focus is on the menstrual health and hygiene to make sure that all these women follow the hygienic practices of menstrual health and hygiene. And through our livelihood initiative, we also try a partner with Mr. Muruganathan to make sure that these women are able to manufacture the sanitary napkins in their own village through the self-help groups. And it gives them an economical option and a sustainable livelihood through this initiative.
Thank you. Next, we have Ms. Bindu Agarwal.
Good afternoon to everybody, and I am happy sharing this platform with the people international repute. And I am professor of entrepreneurship and innovation at Ireland University. And my area of work related to mentoring and giving guidance to the women or the students who want to start their entrepreneurial venture. So I came in touch with VYOMINI 3 years back, and since then I've been working with Prachi, and I wrote a research paper on the business model of the VYOMINI, which she has adopted, which is wonderful. And I think this kind of business model where you are including the stakeholders directly into manufacturing, distribution, and reputation building and brand building, it is the way we can go ahead, whatever we have in our agenda on the Menstrual Day, International Menstrual Day. I think VYOMINI can be the representative of a true representative of this day, and I wish you a very happy menstrual health day to all the women on this platform. Thank you.
Thank you. And last but not least, we have Miss Angela Bowen. Angela, are you here?
We can't see her. Maybe she is facing any difficulty in joining. So in a while, she will be joining.
Okay. So while we're waiting for her to join, the first question that I'd like to ask is for Miss Purity Naga. Now, would you be able to tell us a little bit about, let's just talk about the importance of Menstrual Health Day. And can you give us a lay of the land? Because a lot of us are not familiar as to what sanitation awareness is, what hygiene awareness is, especially in your part of the world. I think Ms. Naga, the question was for you. If you wouldn't mind, I think unmuting the mic. Yep, there we go.
Thank you again. First, I would like to say that we are glad having this conference here in Kenya. And according to us, what we mean by menstrual practices is actually the general hygiene that a woman or a girl takes during her menstrual period. That is like she should be able to get menstrual products which are affordable, get to know how to dispose them, and also access water and soap during this particular period, and also be able to get adequate information concerning the urinary tract infections. Thank you.
Now, Vanessa, you also work with underprivileged communities as well. Can you tell us a little bit about the lay of the land in your part of the world, and what menstrual hygiene is, and what work has been or is being done for it, and what work you do for it?
Well, I especially don't work exactly on this theme, but there is a great movement here in Argentina that is called Feminist Economy, which work in this field like very, very much. And they are right now basically like fighting for three things. First of all, to eliminate taxes on the menstrual hygiene products. Second, they are asking to the government for providing free tampons, pads, cups in schools, prisons, universities, hospitals, and community centers. And they are also trying to make some research, like local research, about this issue in order to count with official data to design public policies.
And Odette, same question to you, because there's very little media coverage of Trinidad and Tobago, especially to the international community. So can you tell us a little bit about the landscape over there, menstrual hygiene and the work that's being done, perhaps some of the challenges that you guys face?
Okay, here in Trinidad and Tobago, we are in the Caribbean islands. A lot has been done over the years, and I must say we are recognizing World Menstrual Health Day here in Trinidad and Tobago. I have been in contact with one of those persons that has an organization that's trying to bring awareness and education to women and girls and in population in general. And over the years, the government would have done some work in that, taking value-added tax off of menstrual products so that it can be affordable and, you know, reach the persons that would need to get these. We still have some work to do, as I said. There's still some taboo, excuse me, around the whole menstrual experience for women. In our workplaces, we still have some work to do. Because this is a part of our lives. It's not going to leave us until we reach that period of menopause. So we still have some things that we need to put in place in our workplaces and in our schools. And just like Vanessa would have said, the availability of menstrual products, because there are still families that are not able to afford these, especially families where you may have a home of 4 or 5 girls and a single parent. So we continue to work, and as I made promise with one of the organizations today, I will continue to work with those organizations to bring that awareness and education.
Great, thanks so much. Now, Dr. Thakur, can you give us a little bit, because in India at least, and I'm sure some other countries, I'm so excited to do an international panel because everyone's from all over the world. But in India, at least, where I'm from, a lot of people are, a lot of women, even in metro cities, are still largely unaware of menstrual hygiene. What is being done in India? How can we overcome this challenge? It's a loaded question, but I'll leave it to you.
Yeah, sure. I would like to say that as we all know that our phases of life, they start into 3 main phases for the females. We are child and going to the teenager state, and then we lead to the menarche. From menarche till menopause, we are again into that phase where all our hormonal changes, they happen once in a month, and we have to work out with the ovulation and all other hormonal changes. And finally, we lead to the menopause. So these 3 stages of female life, they definitely give a very, very important impact on the hormonal as well as the emotional issues of the females. I would like to say that working out with the menstrual hygiene and all the things, we have to work out mainly with the endorphin and serotonin secretions into the emotional level of females, where we can really empower their mental state of conditions and work out with the menstrual hygiene and all other aspects of female health. Now, in India, we should definitely work out with these things through many holistic sciences, because in being an Ayurvedic doctor and working out with the field of naturopathy and yoga for past 20 years, and my experience with this for past 26 years with my studies, I could find it out that not working out much with the chemical conditions of the systemic things, but if we work out with some of the holistic and home remedies, where we can just work out with our hygienic conditions of vaginal area as well as the female reproductive system, and few of the herbs which can improve our hormonal level and help our serotonin and endorphin secretions. That will definitely put an impact into the systemic action of female reproductive system, leading to pituitary, thyroid, and uterine axis aligned, working out very well with the system of menstrual cycles, menarche, as well as menopausal hormonal changes. Over to you.
Thanks so much. And now, before I get to Manisha and Bindu, I just have a question for Miss Purity again. Would you be able to tell us, perhaps, just feeding off Dr. Thakur's elaboration, what types of challenges do you face in your part of the world?
Actually, you can hear me?
I can hear you. I'm going to add one part to that question. Okay. What types of challenges do you face? And since we have women across all time zones, across, we can see the importance of this issue. People have woken up at 2:30 and 4:30 in the morning to be here, and at other odd times. We can see the importance of this issue. So number one, what types of challenges do you face? What help can the international community provide to you?
Thank you for the question. Actually, Kenya is in Africa. And concerning menstrual challenges, most of them are faced in the rural areas, where quite a number of women and girls are low-income earners, such that they cannot afford the sanitary products because they are quite expensive. And also we have a poor accessibility of roads, meaning that even distribution of these products to the rural areas is quite a challenge. We also lack water, access to running water, especially during these times. So sometimes getting to personal hygiene. And I'll give an example, like when you visit a toilet, sometimes after the change of the sanitary towels, like cleaning of hands, sometimes it's a challenge, especially in the rural areas. Also preparedness, especially of the teenage girls. Most of them, they lack information. So like we need to do a lot of awareness in terms of menstrual health topics, as well as the sexual topics. And also another challenge is accessing privacy. You find like most of the washrooms even in urban centers and also in towns, they lack knobs. Some of them even, they lack bins where you can empty your used sanitary products. So these are some of the challenges that we face. And I would because we are looking forward to working with the rural women who are in groups who want to start like a manufacturing farm where we can have the locally eco-friendly products being manufactured. And we lack adequate capital. So we maybe ask for support when we get started with our project. Thank you.
Great. And those are all important tenets. So the next question I have is for Ms. Bindu Agrawal. Thank you for joining us today, and thank you for waiting. But very important question. You come from sort of entrepreneurship background, especially in the development sector. So now what Ms. Purity was saying in terms of support, is there any way that entrepreneurship can help in this aspect, and how?
Yes, very good question you raised, Priyanka, indeed. So I see the entrepreneurship as the solution to the basic problem we are facing in the menstrual hygiene. So as I have been talking with the VYOMINI and I've been associating with other startups, so they are the change makers. Actually, resources are scarce in every economy. If I talk about India, especially rural India, so we find the same, more or less same situation Purity has mentioned now. But at the driver's seat, if we take the charge as a woman or as a stakeholder, if we take the charge for that cause and involve the women in the manufacturing, in the supply chain management, in the every aspect of this kind of sanitation awareness, starting from awareness to delivering final sanitary products. So I think we can make it a movement. Whatever vision the VYOMINI is having to see in the future. So I think every economy, every nation can replicate this kind of initiative, and they have created very good business model where they are providing the training programs, starting from training to finance assistance, and then giving them the basic help in marketing and branding, and then exploring the different supply chain platforms, including the e-platforms, and then hand-holding and mentoring. So these kind of like a support system, if we could create in the in the ecosystem of a given place, whether it is east part of the world, west, south, more or less situations are serious when we talk about women and women-related areas. So I think we need to take charge as a women for this cause and give our best to see the new light in the future.
Now, Manisha, the next question goes out to you because now there is a very important sort of common thread that I see here. Now, we have South America on the call, we have Africa on the call, we have the Caribbean islands, we have other parts of the world, we have India. So I think we have most continents. And one of the common threads that I see here is the issue of accessibility and inclusion. Now, you have worked with over 100 villages, in this aspect. Is it possible that this help, because I realize that challenges within the country are great, right? Within your area, within local areas, especially when it comes to menstrual hygiene, they're very overwhelming for someone to solve all of these problems. But is there a way that this support can be extended to the international community, especially since you are doing the work that you do? It is important, of course, to India, but it's also important to the rest of the world. Is there a way, or are there challenges that need to be overcome?
I think definitely there is a way, and there are various initiatives run by various corporates. I think we need to leverage and collaborate together is the key for us to make sure that it reaches to the last mile and to everyone wherever it is required. And I think what the government is doing and making sure that all the adolescent girls in the school get the free sanitary napkins. Similarly, there are state authorities who are doing it. So some of the best practices, if we can be picked up and we can scale those up in the different countries. I think inclusion and diversity is another area where we are trying to address all the issues related to adolescents, girls and women. How do we create a comfortable work environment and also help them in their difficult days? So how do we make sure that the way educational institute and the working environment is providing the awareness and providing the access to the sanitary napkin is also become a one important element in their work environment. One of the best practice which Amazon does is that in each of our premises, we do have a female nurse who can take stretches with the women, help them to understand what are the body movements and the problems you can face during the menstrual period, and what kind of one of the major challenges, women don't take care of themselves. So most of these women are anemic, they don't take a good nutrition care. Second is during the grocery or during making their monthly budget, they don't think that spending on the sanitary napkin is important. So how do we create awareness and make sure that this becomes a priority in their spends? This is something very important because they save the money for their children's clothes, they save the money for their husband's spiritual trip, and for doing something for their in-laws, but they don't think about their basic right of having the hygienic practice. And that's something need to be promoted, and it should not be only limited to India, but it need to be scale it up across the intercontinental and the different countries. And definitely companies like Amazon and other like-minded corporates can come together and try to help wherever we have a reach and presence. Priyanka, does that address your question?
Can you guys hear me? I think
yes.
I muted my mic. So I think you highlighted, Manisha, a very important aspect that, because women don't place importance on their own menstrual hygiene, or perhaps are unaware of the importance of it, and they don't invest in it. They invest in other things because they are not aware. It leads to a lot of problems. So Ms. Charles, Ms. Odette Charles, can you speak to perhaps some of the problems faced by the female workforce because of it?
In terms of the female workforce, and traveling to India gave me the opportunity and probably even opened up my awareness a little more on the whole issue of menstrual health. And looking at it from where I sit, we still have some work to do. And talking to a number of persons today, we looked at just the facilities that are available at workplaces. Yes, we have the running water, but sometimes we don't have the privacy where, as a woman going to work, having her menstrual, to go into the washrooms to change a sanitary napkin, you have to go in because sometimes the washrooms are not well enclosed. So you're in there, and because this thing of menstruation at times is like a shameful thing. So you're in there and you're trying to be quiet to do it, and you come out and you feel how, because somebody probably heard that you are in there changing a pad. And we need to bring awareness. This is a part, as I said before, it's a part of our life. It's going to stay with us until menopause. And from research, a woman would menstruate for probably 30 to 50 years of her life based on when she starts and when it ends. So organizations, and I'm glad for a platform like this, organizations need to take this into consideration, because workforce is made up mainly of women in my part of the world and in other parts of the world. So one of the initiatives that I will push, is even starting with my organization, is to look to see if we are providing safe and comfortable environments for our women at work as they go through this period once a month. And when I say period, playing on the word, once a month for 5 days, and not make us feel that, I have to be ashamed. And again, that goes back to education and awareness by your parenting, or by parents, or whoever are the ones guiding these girls. So I am hoping that from our end, we would be able to work on this. And I'm glad for a platform like this where I can communicate with other women and bring awareness to menstrual hygiene.
Thanks so much. And now the next question goes to Vanessa. I do want to get to sustainable practices with Dr. Thakur and Prachi as well. But the next question goes to Vanessa. Now you come from a sort of, I would say, entrepreneurial background as well in terms of development and training. Now, is this the solution? Is it important that, and is it a part of perhaps inclusion that people are aware of in terms of entrepreneurship development, what to do, the importance of it, the awareness of the right to be hygienic, I guess, the right to invest in menstrual pad versus, your husband's trip, as Manisha was saying a little earlier, or in your gift for your in-laws. What is the impact and what is the importance of this development training, and is it needed across the world? Development skills training, I should say.
Well, when I've been to India because of a course, and I know this VYOMINI organization, I was like really surprised about, as she said before, the amount of entrepreneurs that are investing and that are working with pads and the manufacture of pads. That in my country, in Argentina, it doesn't happen. We don't have entrepreneurs that are working on that field. And what I feel right now is that it is like a great mistake, because I was hearing about the issues and challenges that you have in India and also in Africa. And I think that in Argentina, we have the same challenges. I mean, menstruation is still a taboo in our country. A lot of girls do not go to school because they are on those days. Women in general have lower salaries than men, and we have to pay large amounts of money on menstrual products and pills for the pain. And also in my country, it is not yet considered the menstrual products as a good of basic need. And as you said before, in schools, we don't receive a lot of information about menstruation. So I think that in my country especially, we have to still work a lot about that, but from the private field, from private entrepreneurs, and also from the state, like we need public policies that tackle these kind of menstrual issues.
Now, Dr. Thakur, based on that answer, sustainable development, both in terms of manufacturing the pad, handing out the pad, distributing the pad, both locally and across maybe a further distance. Can you talk a little bit about it? Because I don't think a lot of people are aware that sustainable practices do exist. So can you tell us a little bit about what sustainable practices do exist and the importance of them, and perhaps how easy it is, or if there are challenges, what sort of challenges you face?
Yeah, I would like to say that, knowing this, that there are different kind of changes into the female health, and the main things which comes out to be, let me start it with from our basis of Ayurveda, that in this case we work out with the body contains different kind of hormonal changes into the system, and with this our body gets into the heated pattern of 14 days to 26 days till the menstruation ends. And in this case, when the menstrual hygiene comes into picture, in these 14 days there are few things which needs to be really guided to the females, which can help the hormonal changes, which can help the general female health care, which can work out with the system and make the female more acceptable to all kind of challenges coming into the day-to-day routine. Knowing this, we should say that first of all, I would like to say, as I'm just hearing and across the world, we are finding the same kind of problems as in India also. So I would like to say that knowing this, all these conditions, we should work out more into the, no doubt, to the sanitary hygiene and sanitary pad uses and all. But there are common things which can really work out to sustain this mental health and this physical health of the female. Working out with, there are few things which I would like to emphasize with Ayurveda. Am I going on the right path, Priyanka? Is it going workable? Okay. So I should be saying there are few things which can really work out for across the world for all the females. And they are very beautifully, very emphasizedly written in our Vedas, and specifically Ayurveda. Those are 6 particular things which can really sustain, rather than going for any expensive things and working out with our system to get a hygienic condition to make our system more sustainable to better health. I should be saying there are few very beautiful things which are written, and those are going for the home remedies to work out. And this awareness is very, very, very much must for the people. Like, say for example, very beautiful in Ayurveda, very beautifully it is written that in once a day, if a female which is near to menstruation, we know that our cycle starts from 25 days to 35 days, and in those 21 to 35 days of cycle, if we work out with our menstrual hygiene, as well as the work out with our systemic conditions of vaginal hygiene, we can really work out with this. And in this, in Ayurveda, it is very beautifully written, few of the herbs which are known as Garb, Sansapan, Mahakshayas. I would like to just show few of the things which can really help every lady across the world. Say for example, we know the chia seeds. Chia seeds are there, and those, if we make a little bit, make powder with the turmeric, we go for a little tasting of milk with it and apply it. It can definitely work out on your sustainable health during the menstruation time, number one. Second is, if we work out with our generalized conditions, sitting on the ground for some time, it works out with our heating conditions of the system, help the system to heal more better way, and make your system more susceptible to get good immunities. If you work out better with your diet issues, which can help to sustain your immunity as well as hormonal balance, it can help your system also to work out better with the menstrual health and hygiene. two main herbs which can really help our system, and the ladies sitting in all part of the world, which we know that it is available everywhere now, most in the food courts, as well as your daily routine practices also are like ashwagandha and shatavari, which we can keep as a powder and take it as like 1 spoon from 21st day to 35 days cycle, depending upon the female. So it can really make your system sustainable for better health and make your approaches more towards the hygienic conditions of female menstrual cycles.
Great. And now I think, thank you, Dr. Thakur, for that answer. Because I want to ask Ms. Agarwal, now you have helped also create sort of business plans for sustainable health. Can you talk a little bit about what a possible business plan looks like? Because I think the rest of us don't really have an idea of, you know, one can say, yes, these are the best sustainable practices. One can say, yes, it is cost effective. One can say, yes, skills training is needed and it's easier than you think. What does a business plan look like? I think you've muted your mic.
Okay, thank you, Priyanka. So this is something which I really wish to discuss with this August panel and the people who are attending this webinar. So business model is nothing more than the plan of action in the future. So when I talk about business plan, it is just figuring out what steps are need to be taken before we start our venture. But here I would like to mention that the business model or the way we do business, which is need to be very creative and innovative when we are dealing with an issue which is very sensitive, which is very vital, which is socially associated in every culture and every country. So the business model, which is the future of social entrepreneurship, which I can see with the experience, little experience, whatever I have in my past few years. So involving the stakeholders, who are the real customers, involving those customers or the stakeholders in the mainstream, and which is done beautifully by the by VYOMINI. When I wrote a research paper, one of my colleague, Ali Mishra, so we were wondering how the future of the social entrepreneurship we defined. Then we deeply studied the model of VYOMINI among other few cases, other social entrepreneurship few cases, and I found that the vision of VYOMINI is wonderful. I'm not just praising VYOMINI at this platform because Prachi has given me an opportunity, but I am sincerely explaining, and I take the responsibility of sharing this information, that this is the model which is futuristic, where you are giving the awareness training, you are giving the entrepreneurship training, where you giving the hand holding to the women and giving them courage. Okay, come on, step out, and we are here to hold your hand in terms of making the business plan, in terms of going for the financial assistance, or making aware them with the government policies or the schemes for the women we have in India, and what are the special thing or the special packages they can have when they once start taking one step. And this is not enough. In the initial stages of an entrepreneurial venture, women need more than that, because they face social challenges, they face opposition from their family members and their spouses. So all these things are need to be taken care of with the support system, mentoring, hand-holding, and giving them the courage. Okay, you can do it. Because once a woman take this courage, okay, she is confident about taking first step. From my personal experience, I have seen that she covers a great journey. So this kind of business model, I see that wherever the hiccups are lying in developing a business venture, and there is a support system in this whole entrepreneurial ecosystem, and we take care of those points, then then this is the business model which is workable. We are not talking about the manufacturing of the sanitary products and the great MNCs of big factories. We are talking about micro factories. Wherever the demand is lying, we need to reach out those places, train the women, and take the responsibility of their own, and spreading the message of menstrual hygiene, what kind of importance they have in their life, and let them be the brand ambassador and the awareness agent, so that the issue of women is taken care of.
Yep.
They are able to do it. So this is something which I would like to speak on, and it's great.
Thanks. And that's so important. And I'd like to hear from since we just have a few minutes left, I think just under 15 minutes, I'd like to hear from especially our international panelists. Ms. Naga, perhaps you can maybe address the issue of coronavirus. That is a pandemic right now that has hit the entire world, I think it's safe to say. Multiple countries are affected. So as we are talking about, maybe perhaps international collaboration, initiatives, business plans, manufacturing, skill training, development, all the things that we've spoken about just in this short time. What is the way forward, keeping in mind the hindrances that are caused in perhaps mobility, way of life, that coronavirus right now is doing? India right now, for example, has been in a lockdown for over 50 days. And I think we're pretty unclear as to what the future is, but it's definitely going to be a new normal going ahead for the rest of the world, I would say.
You are muted, Purity.
So I think just because we have a little bit of time while Miss Purity unmutes her microphone, can I put the same question? I wanted to ask the same question to Miss Odette Charles as well as Vanessa. Odette, why don't you go first?
Right, are you hearing me?
Yes.
Okay. One of the COVID-19, as you said, has really put us in a place that we have never been before. One of the things that came out while I was having a discussion with one of the organizations today is that a lot of people were donating food, but we neglected to do the sanitary products. So there's a drive now to get sanitary products to distribute to some of these families. How do we go forward with our new normal, which we do not know what we don't know what it looks like? What we are doing here now is one of the ways that we can continue to bring awareness and education to the persons, women and girls in our world, which is virtual. Because we are not mobile, we can't move around as we would have normally done in the past. Education, we will have to continue to maybe do videos, webinars like this, Facebook Live, just to continue to provide the information. And there are organizations that may have the PPE to move around in smaller groups, not in the large way that we would have done it in the past, to reach those persons who are in rural areas who may not have access to internet or to smart devices to hear us, but the message still has to reach those persons. So we would have to maybe work in smaller groups to carry the message forward on menstrual hygiene and concerning awareness and development. Yeah.
Vanessa, do you have anything to add to that, especially with something like development and skills training in entrepreneurship? What challenges does COVID-19 pose to you? How do you plan on overcoming it? Or have you created a plan so far on overcoming it?
Well, I work for the government, so I don't have I don't have the control or the responsible to change the program. They are still working on that. I'm just a facilitator, but what I can say is that COVID-19 has exposed more than ever all the inequalities and vulnerabilities there are, especially for those underprivileged communities. In fact, in my country, there's a very big slum where for the past 2 weeks, there was no water. So how can we talk about hygiene if there is no water? How can we talk about preventing the COVID-19 if we don't have water to sanitize or to wash our hands? So especially with a group of organizations, what we are doing is, as Odette said before, getting some or preparing some workshops for women and also about hygiene. And also what we are doing is a kind of great campaign to get some private donors and collect some menstrual products so that women can have a safe period.
Great, thank you. Ms. Purity, do you have anything to add to the same question?
Thank you again for the question. COVID-19 has really been a challenge here in Kenya because we are quite immobile, and also getting the sanitary products to the rural areas when it comes to distribution, it's also a very big challenge. So how I wish that we can have some small manufacturing industries like in the rural areas. And actually from our training in NIESBAD, I really got to know we have a lot of untapped potential in the rural areas. We have a lot of raw materials in terms of banana and bamboo that are used to make eco-friendly menstrual pants. So I'm looking forward to maybe trying to talk to the government that we are able to get some small industries in the rural areas, because I know right now getting the product to the rural areas, because they come from cities, the distribution channels are already blocked. So it's a major challenge and we are suffering. Thank you.
Thank you. And I think last question before I hand it over to Prachi, but this one is for Ms. Manisha. Now, in a company like Amazon, it is an MNC. It can reach many parts of the world. What's the way forward, especially with COVID-19?
Yeah. So considering the COVID-19 situation, and we realize that one of the challenges is that when we are talking about essentials, we also need to think about menstrual hygiene is one of the essential thing for women. So how do we make sure that it reaches to all the areas? And therefore we are partnered with a lot of government bodies. So in Mumbai, we have partnered with the BMC, we have partnered with other state authorities to make sure even in the cantonment zone or in the red zones, how do we make sure that the essential products, including the sanitary napkin, reaches to all the women and the communities as a part of our distribution network. We also work very closely with our community-centered network and our NGO partners to make sure that we able to support the underprivileged women during this kind of testing situation. Even during the cyclone, like we recently hit the cyclone in West Bengal and Odisha. And during the cyclone also, when people have to evacuate the house, and the first thing, as one of the panelists said, that we think about the food, we think about other things, but we don't think about menstrual hygiene as one of the element to be taken care of. So we worked very closely on that element and make sure that as a part of a hygiene kit, how do we reach out to the women and provide them? The first thing is a hygiene kit, which comprises the sanitary napkin. And globally, Amazon makes sure that, wherever we work, we do, look into this element and collaborate with our partners, because, at the end, the charity organization are the subject expert, and they have a reach to all the underprivileged communities. So how do we get the right inputs and collaborate wherever it's possible?
Thanks, Manisha. And now I think we have just about 4 minutes left. Last but not least, let me ask Ms. Prachi, who has put together this entire session. Now, Prachi, I think some of our audience is also Hindi speaking, so they are requesting you to perhaps speak in English or in Hindi. Can we talk about 360-degree sort of solution? I know we were talking a little bit about that, and it was very intriguing.
Thank you, Priyanka, and all the panelists for highlighting the challenges, issues, and the solution. Not only the challenges, the solution. I'll really appreciate the team Amazon during this COVID crisis. They're supporting the marginalized entrepreneurs. They're procuring material from them. They're providing essentials, non-essentials, and other support to the last miles. And we are really glad to have Manisha ji, you, and in a very short notice, and all the panels has come in a very short notice, just because I can see your concern for the society and for this cause. Not only this menstrual hygiene day, the other things, because they all come together. If you, one way we are fighting for the COVID, against the COVID, then there is a natural disaster in Bengal, and at the same time, millions of women, migrants women on the road, they're bleeding, though COVID hai ya nahi, they're still bleeding, and they don't have any infrastructure. They don't have any resources, hardwares, and it's very difficult. Delivery is happening on the road, and the situation is like this. So whatever happened, just because we have local approach. Recently, our Prime Minister announced be vocal for the local. We have that decentralized entrepreneurship model. This really helped to procure sanitary napkins easily when the factories were shut down, when there was no shops open of medical shops, and people were coming to our women groups, and they were asking sanitary napkins because they knew and they can find there without going to the any market or any shop. So we did this, and we really took the advantage of this crisis time. And Purity just mentioned that the kind of challenges they're facing, this country having a lot of natural resources, natural fiber, this can be used. And the whole session is on the sustainable menstruation. We're already doing. So for the participants, thoda main Hindi mein, please apologize who cannot understand Hindi. कि आपको अगर सैनिटरी नैपकिन नेचुरल फाइबर से बनाना है, व्योमिनी आपको मशीन, रॉ मटेरियल, कच्चा माल प्रोवाइड कर सकती है. कच्चा माल लेकर आप सैनिटरी नैपकिन बना सकते हैं, और सैनिटरी नैपकिन की मार्केटिंग, पैकेजिंग कैसे करनी है, उसको तरह से जांचना कैसा है, बढ़िया क्वालिटी का कैसे बनाना है, हम एक ट्रेनिंग प्रोग्राम चलाते हैं MSME मंत्रालय के साथ भारत में. तो उसके जरिए हमने गांव-गांव में जाकर मशीनों को सेट किया, और जो महिलाएं हैं, जो एक तो उनको रोजगार मिला. आप ही देखिए, आज मेंस्ट्रुअल हाइजीन डे के दौरान लोग बात कर रहे हैं अवेयरनेस की. हमें अभी प्रियंका जस्ट मेंशन 360 डिग्री सॉल्यूशन, तो हमें इतने NGOs इस वेबिनार को अटेंड कर रहे हैं, तो सिर्फ अवेयरनेस पर लिमिटेड नहीं रहना है. आपका बिहेवियर नहीं बदल सकता अगर आपके पास प्रोडक्ट नहीं है. If you don't have product, you cannot change the behavior. और प्रोडक्ट भी कैसा, सस्टेनेबल. तो उसके लिए हमें पूरे सबको ही साथ में काम करना होगा. और जो 360 डिग्री सॉल्यूशन की हम बात करते हैं, ये ग्राउंड पे भी हमने करके दिखाया है. अवेयरनेस, अफोर्डेबिलिटी, एक्सेसिबिलिटी, 3 A's हमारी स्ट्रैटेजी है. तो भी NGO, संस्थाएं, सेल्फ हेल्प ग्रुप्स इस काम को आगे लेके जाना चाहती हैं, आप सभी का स्वागत है. 1 घंटे के सेशन में हम बहुत सारी बातें नहीं कर सकते. हमारे पास डॉक्टर गरिमा ठाकुर हमारे पैनल में है. अगर आपको कभी भी महामारी से संबंधित कोई भी समस्या है, तो आप उनसे बात कर सकती हैं. और जो पे नहीं कर सकता है उसके लिए हम फ्री कंसल्टेशन ऑर्गेनाइज कराते हैं। और सस्टेनेबल से मेरा मतलब है कि आप ऐसे ही कोई दवाई ना खाएं, बिना अपने शरीर को नुकसान पहुंचाए कैसे आप हेल्दी रह सकते हैं। तो उसके लिए व्योमिनी सदा आपके साथ है। और आई कम टू इंग्लिश नाउ because the other is looking at me while she's talking and we can't hear. So Vanessa, when I met her, so she took the keen interest कि कैसे entrepreneur we can add this component of sanitary napkins, and we are not just manufacturing sanitary napkins and providing training on sanitary napkins. We are making sanitizers. We are making all the COVID-19 protection. Our women has made the mask. They're being bought by the big MNCs companies. So it's not only about one product. We have created this ecosystem. और इस ecosystem की thank you. इस ecosystem की वजह से ही आज हम कोरोना से लड़ पाए और हमारी महिलाओं को रोजगार मिला. They can get employment at the same time. We have many people and they are eager to speak, but the time do not allow, and our moderator is very strict, so we have to obey her. Thank you, Priyanka.
No, thank you, Prachi. I know I gave you very little time to explain a lot, but what you've said is very important. As you said, it's not just about one product. It's about creating an ecosystem, and it's about creating employment, which leads to that accessibility, inclusion, and empowerment for women. So thank you so much. And I want to thank everyone, Prachi included, for putting together this panel, and for all of you to join in the middle of the night, in the middle of your morning. I know your entire day has gotten disrupted completely, but thank you so much for joining. And that really comes from the bottom of my heart, because this issue is so important. And it is something that is needed and is going to be needed, especially in the times to come after this pandemic. So I really do want to thank you. A big namaste from New Delhi.
One more point, Priyanka. Priyanka is a journalist. She works in a New India Junction, and she has covered our story, and she is a woman daily breaking some sort of taboos and stigma. And she's a good leader, and through her journalism, she's covering true stories of the women. She has covered our NSIC Okhla Training Center, and she has interviewed many women, and after the interview they were so excited that itni badi journalist aake humse baat karke gayi hai. They were so thrilled. They were very happy.
No, I'm not that big at all, but we did cover, and that was a very good story. So I will share the link. Prachi, if you want to share it with the rest of our panelists, do get in touch with me.
That's what I wanted to add. Priyanka has covered a story, and you can find New India Junction channel, YouTube, and you can see the story. And I have shown you a few of my friends this story. The same story was covered by the Priyanka.
Awesome. Thank you so much, Prachi, for that. With that being said, let's end the session. A big namaste to everyone. Thank you once again, and have a great day ahead. And happy Menstrual Hygiene Day to all of you.
Yes, thank you. Thank you.
Thank
you.
Bye-bye,
all.
Namaste.
Let's connect after this meeting. Bye-bye.